So I'm a parent of athletes. I have one kid at Princeton, one's gonna go to Brown, but I have an 8-year-old who is a flyer in competitive cheer. She gets hurt sometimes. How should I approach that with JAG-ONE?
That's a great question. JAG-ONE Physical Therapy has education programs for parents all the time for all sports. We have agreements with over 150 clubs throughout New York, New Jersey, Pennsylvania, where we actually go and educate the athletes with their parents and coaches, so everybody is getting the same education to understand the best thing for an athlete is to be on the field, the court, the ice.
When a child gets hurt or a young adult gets hurt, what should the parents be doing? Because sometimes they just want to rest and put some ice on it. And what should a parent actually do?
There's always a component of rest, but realize the body was made to move. So the best thing you can guide parents, and we even do it with a tremendous amount of pediatricians, is when there is a contusion or a sprain or a strain, we'd rather get them in as quick as possible so the injury does not linger. Mom and dad aren't going to be able to indicate that you have full range of motion. Can you run? Can you jump? Can you cut? JAG-ONE Physical Therapy loves getting patients in and getting them back as quick as possible.
So from an individual standpoint or a parent who's bringing their kid to physical therapy, it sounds intimidating. What should they expect when they walk into a JAG-ONE facility?
First and foremost, we welcome you. We want to assess you. We want to understand what the scope of the injury is. Is there weakness? Is there pain? Is there loss of range of motion? What is the goal of the individual that's rehabilitating? And then ultimately, our physical therapists come up with a plan of care to treat you, and they give you a time frame of goals. They give you an anticipation of return to sport. And then usually, depending upon the plan of care, we're seeing the patient 2 to 3 times a week, and hopefully with a soft tissue injury, within 3 to 4 weeks, you're rocking and rolling and back to doing the things you love to do.